I met my social worker shortly after I was diagnosed with cancer. I was 23 years old. I can honestly say that my social worker was probably there on the days when I was feeling my absolute worst.
Being an excellent clinician is one thing, but really practicing in a way that's grounded in evidence, I think makes the difference between being a good clinician and being a really fantastic clinician. And I think those are the benefits of the Advanced Masters of Social Work course. I think from doing this course, I feel more committed now than ever before to ensuring that my practice is really grounded in the evidence, and in ensuring that how we look after young people is really based on good, solid assessment and not just on opinion or practice wisdom, which is how I think I've worked before.
I had lots of worries about how my family and my partner were coping. Silly things like my hair falling out and changes to my identity as I became a cancer patient, and that was the first thing that people saw.
I think it's very important for social workers to have advanced skills for their practice, and that is what this course gives you.
Life doesn't just return to normal once you finish chemo, and the transition to what they call survivorship can sometimes feel as tough as the treatment itself.
Having done the Advanced Social Work program has enabled me to have a better understanding of what the evidence tells us about what the needs of young people might be coming off treatment, and then being able to look at the evidence and then think about, together with my colleagues, what we might be able to do to address the needs of young people, and then develop a program in response to that, has enabled us to implement something that's suitable and appropriate to meet the needs of young people like Alice. So as an advanced practitioner, being able to have the opportunity to educate and train others on improving how they care for young people means that we're reaching more young people who can receive better care, which leads to better outcomes for them.
I'm feeling a lot better now, physically, doing really well. Coming up to 9 months in remission from my disease. Still got a little way to go mentally and emotionally in processing what's happened, but I feel like I'm really in a good space in terms of learning to cope with what's happened, and really feel like I'm moving forwards and learning to live life in a really positive way.